Hello, welcome to the BeckyinBoca show. Tonight we're going to be talking about skincare. I'm really excited about this product. It's called Nourishing Biologicals. And I have George Sadowski, MD, who is the CEO of Nourishing Biologicals, and Natalia Sadowski, she's the Director of Aesthetics. So I got to move this over here. It's really pretty packaging, but it's not just the packaging. You're a surgeon, correct?
Correct.
And
by training.
You developed this skincare product?
Yes.
Okay.
In other words, I'm not just another white coat who,
Right.
who was hired to do the pitch.
Okay, well, I'm all about skincare.
I have firsthand knowledge of what we did and how we developed this thing.
Okay, that's fantastic.
Our products are based on the free radical theory of aging. This is how we all age.
Okay, and in Boca Raton, we're all about anti-aging, so you're right up my alley here.
So we're constantly aging. We're constantly exposed to the sun and other harsh and environmental conditions.
Uh-huh.
So it's inevitable this thing is going to be seen on our skin.
Right.
That's where the evidence comes
Hard
in.
as I try, I stay out of the sun, I wear sunscreen, everything, I still get brown spots, wrinkles, of course. Mm-hmm. So tell us what makes your product one of the better ones that can help us out here.
It's really our ingredients. We have sourced ingredients from all around the world. The finest quality, pharmaceutical-grade, which is usually used in medical research.
Okay, so your product is used in doctors' offices too, as well as available to...
Correct.
Okay.
Correct. These are ingredients that have been validated by scientific studies,
mm-hmm.
and we formulated them into our products.
Okay.
And we have a lot of growth factors. We have a nutritional base, marine base with this to mix this in. Okay. We have skin actives. We have anti-inflammatories, antioxidants, and immune modulators.
Okay.
The immune modulators are the ones that keep the immune reaction at a lower level.
Okay.
Because
so what does that do?
Well, like in acne is the insult,
mm-hmm.
but you get a scar from it
mm-hmm.
because of the reactivity of the individual.
Okay.
So you want to tone everything down.
Okay.
Sunburn, you get a tan, then you get blisters.
Mm-hmm.
That's a reaction.
Okay.
So you want to modulate that.
Okay. So now, Natalia, you're on the aesthetic end. So
I am, yes.
Tell us a little bit about what you do with the company.
So I'm a medical esthetician.
Okay.
And I actually help head the Nourishing Biological Skin Institute. So what we do is we go around to different spas and estheticians, and we teach them and train them on 2 different procedures. We have the plasma fibroblast lifting procedure, and it's basically a non-surgical procedure. You don't have to go through any kind of cutting, no anesthesia.
Non-surgical facelift, I heard you say.
pretty much.
Okay, all right. Tell us about that. I'm sure a lot of my viewers and listeners want to know what that is.
So the procedure, it's really minor. It takes about 30 minutes to an hour.
Okay.
You just have a little bit of numbing.
And it's to tighten
painless.
the skin?
Yes.
Oh,
So
I
it
like
actually
that.
lifts the skin. And it
Tightens and lifts. Okay.
Yes. And it sends a plasma arc down into the dermis, which helps lift and evaporate the skin, which, of course, when you
tightens it
evaporate
up.
the skin. Right.
Mm-hmm.
Exactly.
Wow. And, okay, we have this machine here. I don't know if you can see it. I'm going to pull it out. This is one of those machines that you put your face in,
Mm-hmm.
and it shows all the damage to your skin,
Yes.
correct?
So this is our UV skin analysis machine.
Okay.
And it actually shows all the damage that you can't see with the naked eye. So any kind of, brown spots that you might have on there, or might also develop into something you will
What's
see.
coming?
Yeah.
And then harbinger.
That's right.
Okay.
Yep.
We have a picture. If we can show that, I think it's a before and after. We have a couple, so let's put them up on the screen. Okay, here's a before and after with your product.
Yes.
Here's the other one. There's a before and after. Wow.
So this is a non-fibroblast. This is just using our regular products.
Oh, wow.
So the uneven growth, the discolorations, the redness.
You
Which
said
is all
it lightens
inflammation.
the pigment. That's all inflammation?
Well, it will
Okay.
lighten the pigment because it downregulates tyrosine kinase, which is the enzyme responsible for the dark spots.
Okay. I have those. I have my Ivy Lee's. Lisa, you cover them up on the side of my face every day. So I'd be very interested in a product that lightens dark spots. Okay, the fibroblast. What is that?
So it's a little handheld
You might
machine.
have to get a little closer.
Oh, it's a little handheld machine, and it
Yeah.
emits a plasma arc all the way down into the dermis, which helps build it
Is
up.
that an electrical current?
Yes, so
Okay.
it's a little electrical current. It doesn't really feel.
It's not uncomfortable?
It's basically painless. People come in all
We
the
don't mind
time.
a little pain in Boca Raton if the result is good.
And people
I
come
think
in.
I've done just about everything available.
That's right.
There's
It's got
some
to
pain.
be. It's got to be worth it.
It does. Yes, it does. We focus on the end result. But you're saying this is painless.
Yes,
Okay.
basically. We put a little numbing cream on you. Other than that,
Okay.
you don't really feel anything. Very,
Okay.
very easy, very quick. People come in for their lunch break.
Oh, that's nice.
In and out.
Okay.
And, you know,
So it's an
they-
electrical current, and you do it all over the.
You could do it at any
nice-
part of the body, the face.
And it'll tighten up the skin? Ooh, I like that.
Yep.
Are the results immediate, or does it
So
take some time?
results take the whole downtime is about a week. You start seeing results.
okay.
Sometimes 2 weeks in, but you'll see the full result 4 weeks out.
Oh, that's not bad.
Mm-hmm.
So the skin will continue to tighten. And what's the process that's going on there? Is it rebuilding collagen?
So it rebuilds
or-
the collagen and elastin,
Okay.
and thickens the dermis as well.
Mm-hmm.
And then the plasma arc actually gets kind of tightens the skin. Well, not tighten. What's the word? Evaporates the skin.
Okay.
So you do it around the wrinkle.
Oh,
So it ends up evaporating that skin, so it ends up lifting it up.
okay. So now a lot of people in Boca Raton, as you probably know, do a lot of injectables.
Mm-hmm.
Does this help help it last longer? If you're doing
So-
Botox or something like that, does it
we
stretch out the length
so
of time?
with Botox, with this treatment, you have to actually do it around your Botox, but our
Okay.
products do. We've noticed a lot of people saying that their Botox lasts longer.
Yeah, I
when
always
they've used
wonder
our
about these
products.
people that go do the injectables and then don't take care of their skin. It's
Yeah,
like you go to all that trouble. Why not use the right skincare?
yeah.
Correct. So you
Okay.
you eat right, you exercise. Why not? And you take supplements, aspirin and whatever. Why not do the same thing?
Mm-hmm. And you don't worry
for
about the skin, which is the biggest organ in your body.
and the most visible.
Right, right. Now let me ask you. You say you don't just use it for the face. You can use it on other parts of the body.
You can use it for the arms, stomach.
You do your whole body?
Yeah,
See,
pretty
I
much.
was just talking with a girlfriend about that last week. You know, we put so much concentration on our faces. If we could do the same thing for our entire body,
I
that
actually have a
would
lot
be-
of people come in for the neck.
the neck. Oh, that's big.
You know, it's interesting that you mentioned them because we did a 12-week clinical study, and we sent them. We asked them how much product they would need, and they told us, and we sent them the product. And halfway through the study, they said we need more product. And so we said, what happened? He says, well, the subjects in the study are using it.
They're using it on their
a
entire body.
little
And
bit
why
more
not?
than their face.
Why
Well,
not?
they used it on their face. They
Yeah.
saw the improvement. And they said, heck,
Use it everywhere
forget about
else.
this. I'm going to use it everywhere else.
Especially in
Then you
Florida, where we're always our skin's always exposed.
Yep.
And I know it's very very upsetting for women when things start to sag, and you know you get the crepey skin and things
Correct.
like that. So it's not just the face that people are concerned with. Now, if someone wants to get this product, where do they get it?
So right now we just launched our products online. So those are all available for purchase.
So it's nourishingbiologicals.com.
it is, yes.
Okay.
And then we are going to be in spas and retail
And
stores
doctor's
as well.
offices too.
Yep.
Okay.
what people should do is compare the ingredients.
Okay. Tell us about the ingredients.
So we have sea kelp, all kinds of substrate, and I mentioned the anti-inflammatories,
Yes.
antioxidants, immunomodulators, growth factors. We use 6 different growth factors.
Wow. And what do those do?
Those direct the cells to grow and multiply, giving you healthy,
Healthy new
radiant
skin.
skin.
Okay. I love that there's so much science behind this because and that you are a doctor, so you do understand the science. How did you decide to get into this? You were a surgeon, right?
Correct.
What type of surgeon?
I was a colorectal surgeon.
Colorectal. Oh, okay. I know a colorectal surgeon here in Boca. It's a great field. Okay, so then you just decided to start a whole new career?
I started doing research in a molecular biology lab as an undergraduate in the college.
Oh, wow. Okay.
And that product, the result of that ursocholic acid ended up being put into formulas,
Okay.
skin formulas. Unfortunately, the ultraviolet rays from the sun had changed the ursocholic acid from one form into another, which was harmful. And therefore, that was pulled off.
Okay.
But I always noticed the devastating effect that a scar or some skin abnormality would have on a patient.
Yes.
And it affected their entire life. So this was always a quest to use something that would work.
Okay.
And we came to the conclusion that nothing out there was working.
Okay.
So we decided to formulate our own skincare line.
Oh, this is exciting.
Yeah.
Okay. Wow. Anybody out there wants to give this a try? I'm certainly going to try it. And I like your packaging too. I know that's not the most important thing, but look at this jar. It's got like a jewel on the top. Very, very pretty. And this one is the
That's the
product
skin
am I looking
essence. That's the skin essence.
Skin Essence. Okay. So how would somebody what kind of a regimen is it? I know it's just 3 steps, correct?
Yes. So it's
Okay.
morning and night. So you
Okay.
wash your skin, apply the serum, eye cream, moisturizer.
Serum,
Go
eye
to
cream,
bed.
moisturizer.
Yep.
That's easy.
Yeah.
Okay. And how long does it take to see results?
People have seen results as little as about 2 weeks.
2 weeks. Okay. Ooh, this is exciting. Okay.
Now, in our clinical study, we showed we showed improvement at 12 weeks,
Okay.
all along the line. So
Oh,
the
that's
study
nice.
study ended
It
at
started
12
now,
weeks.
Okay.
But we think that the improvement will continue with continued use.
Keep going. That's fantastic. Okay, this one is, I'm going to say this right, a unique skin essence, correct?
Correct.
And what are these other two? This is the Miracular Face Serum,
Yes.
okay? And this one is the eye cream.
Yes.
So I guess you would wash your face and use this first?
Yes.
Okay, and then you
And
probably
then
let
you
that
just,
dry.
massage it in, let it dry, and then you use your eye cream, and then
Okay.
the skin essence, which is your moisturizer.
Morning and night. That's easy.
Yeah.
Okay, and within 2 weeks you'll see results, and within 12 weeks you'll probably be very, very happy.
Correct.
Okay, I like this. Anything else you want to say about your product? I know you told me that a lot of testing was done with this product, and there's a lot of science behind it.
Correct. We used a third-party independent lab
Okay.
to do the test. So we didn't do the test ourselves.
Oh,
and
okay, that's good.
we didn't pick out the good results.
Right,
And,
right.
we just took whatever we got.
Uh-huh.
And they were phenomenal.
Wow. Okay.
They were phenomenal.
Okay. And you have a men's line too, I know.
Yes, we do. Yes,
Okay,
we do.
that's very important now because, even men are doing injectables, mostly Botox. And they're very concerned with their skin. You have beautiful skin, by the way. I assume
Well,
you're using the product.
I've been accused of using my own product.
Right. And why wouldn't you?
Correct. But you mentioned Botox. We have one growth factor in our formula
Okay.
that actually works the same way as Botox A and Botox B.
Oh, okay. What is that?
It's acetyl-hexapeptide 77, but that
So it's a peptide?
It's a peptide. It's a
Okay.
growth factor.
And it works the same way that Botox and it relaxes
what
the
it
muscle?
does, that's right. It relaxes
Okay.
the muscle.
Now that's exciting.
So the feedback that we get is people who have had Botox, first of all, we don't tell them that what's in there.
Okay.
We just give them the products to
And let us
this,
try
just
it.
Let
Okay.
us know how you like it, what it does for you, and so on and so on. So people who get Botox, they say, well, it appears when I use your product, the Botox lasts longer.
Well, yeah, that's what I was saying. You could prolong the Botox
Correct,
with this product.
correct,
Okay,
correct.
well, who wouldn't want to do that? Right.
Non-invasive, it's simple. You just
Right.
apply it, and that's it.
Right. Okay. And the men's line is the same as the women's? The
Three- just
exact
3
same
steps,
steps?
yes.
Okay. I assume not the jeweled bottle, though, maybe. Or maybe it is. These are very nice. What other products do you have on the horizon or other products besides these 3?
We're presently formulating a cleanser, and we already had a sample batch that we tried, and we're happy with.
Okay.
We have a retinol product.
Yes,
and
we were talking about that in the green room. I like that. Is that going to be available then to consumers, or do you have to go through a spa or doctor's office to use that one?
It'll be available.
It'll
to
be
consumers.
available to
Oh, at home. That's
online, yeah.
nice. Very nice. Okay, and it's nourishingbiologicals.com to go and order the product. What is the Skin Institute? I know you were talking about
So-
that in the green room.
yes,
You have a
so-
Nourishing Biological Skin Institute, and you
Yes.
actually go out and train estheticians
Estheticians,
in
yes.
doctors' offices.
It could be doctor's
Okay.
offices, spas.
Spas. Yeah, I had a cosmetic doctor in here last week, and he was talking about how some people don't want to go to a doctor's office.
Yeah.
They're like afraid of doctors, they're afraid of needles. They'd rather go to a spa.
Right.
That's why a lot of spas now are doing injectables. People are more comfortable with that.
Correct.
So I can understand the
Well,
popularity of spas.
Technology can be intimidating.
Yes, it can. And just going to a doctor is scary. You know, it's a whole thing.
It's a whole
But,
sterile
not that it would stop me from getting my Botox, but apparently there are people that prefer to go to spas. Okay, so you go and you train the esthetician on the proper use of your product.
On the product and the treatment. So the plasma fibroblasts, that's where that comes in.
Okay, so talk
I
about
train
that.
It's a 2-day training. We teach them how to,
And if there's anybody with a spa out there listening,
so we teach them how to do the actual treatment, any kind of contraindications, the whole thing that they would need to know when they see clients. And then the products are used as the aftercare products.
okay.
as well.
And then they take the product home. So they get it in a treatment, but then they can also take it home and use it.
Yep.
Okay. I have some spas for you to meet because this is a great product. How do estheticians and spas request training or learn more about you if anyone is watching or listening that wants to try this product in their facility? Because Boca Raton is full of those places. It's like 20 on every block.
So we
Okay.
actually have a website. It's NB Skin Institute.
NB Skin Institute.
And
Okay.
it has ways to contact us, what our training includes, everything.
And then you would come in and train them?
And
Okay.
we actually travel to them.
You
So
go to
we
them?
Yes.
Okay, that's great. That's fantastic. Oh, I got some people in mind for you. Okay. Okay, doctor, anything else you want to tell? I think this is just fascinating that you're a surgeon and then you
Well-
got into the skincare and
It-
but you have great
it's
skin,
Been,
so-
it's been an interest of mine for a long time.
okay.
Our products have a track record. They're based on science.
I like that.
We've got the clinical results.
Mm-hmm.
We have feedback from our own clients, and it's been great. This stuff really works.
So the retention rate on
this stuff
the use of your product is probably incredible.
when they run out,
they get panicky?
they get panicky.
Yeah. I love that. The bottle starts to get low. I got to get more.
They want it.
Yeah, yeah.
I mean, not yesterday.
right.
When can I get some more?
Oh no, I
You know?
I have a lot of things like that I use. The
What happens is, when they run out, after a couple of days, they start seeing things are starting to go
Starting
back
to go.
back to where they used to be,
and nobody wants
and
that.
then they don't want that at all.
Right. I like that. I like that. Okay, so you two you're not from Boca Raton. You drove down here from
St. Augustine.
St. Augustine. Okay. And you're in spas up there, I would imagine. And are you in other states too, or just the state of Florida for now?
We just launched, but we hope to expand.
Yeah. Well, if it's everything you say it is, I don't know why you wouldn't. What is the age group you're targeting for this? All ages, or is it primarily?
Well, people in their 20s, they don't have any problems, and number
They
two,
think they don't, but they're doing Botox.
they may not even recognize. But by 30, you're starting to see some telltale signs that something may be happening.
Yeah.
And by 40, it's happening.
I think
By
I
50,
had more wrinkles in my 20s than I do now, but you know.
and by 50, you think it's hopeless.
Yeah, yeah.
You
And it's
know,
wonderful
and
when you
you're
can turn
desperate.
it around.
You're desperate.
Yeah. When you can
You know what's going on, and free radical theory of aging. Actually, this is what happens. Mm-hmm. One cell, things get disabled one cell at a time, disabling the entire organ system.
and everything starts to go.
Correct.
Ooh, okay.
So our products actually work on a cellular level, and where the true damage actually happens.
Okay.
So
and
we
it
treat the
repairs it.
cause, not the symptom.
I like
This,
that.
this is not a cover up. This
Right.
is not.
It's
this
not
is not
just
a quick
a topical. Okay.
You
That's
nourish
very important.
and repair the skin.
So you're
and it
actually
will get
repairing and
better.
improving the skin.
Correct.
And it will get better.
Now, most medications, they don't
Right.
They don't fix
Right.
the problem.
Right. So this isn't just a topical treatment. This is a treatment to repair damage and to improve the skin.
Correct.
So the skin will be clearer and tighter.
Correct.
Who doesn't
It's-
want that?
I mean, we have a very sophisticated product that works very well.
Okay.
It's one of a kind. Mm-hmm. Look at our ingredients. You'll be convinced.
Okay. Well, I'm anxious to try it. Okay. We have to go here. Anything else you want to say? I'm going to give the website again, nourishingbiologicals.com. You're going to have some holiday specials on there.
Correct.
And I'm going to try it, and I'll let everyone know how it works. And I would encourage everyone else to check it out. Thank you for coming.
Thank you for having us.
Okay. Bye-bye. You have been watching and listening to The BeckyinBoca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the